Okay, I want to talk today about pharmaceutical agents, and specifically, I want to share commercials with you. I did this a couple years ago with one of our groups, and my goal is to help you to think be a critical thinker, put your thinking caps on. And so, with that in mind, I'm going to talk about how we address illness and disease in our country. If you get sick, like Joanne just said, hey, I'm feeling a little bit of irritable bowel. I don't feel very good. Something's wrong. When that happens, you have to ask yourself, how do you address the issue? Well, the first thing is you have to differentiate between an acute problem or a chronic problem. And they're very different. Acute problems would be things like strep throat or appendicitis, or I fall and I break my femur. In this case, it might be I'm constipated today. Well, constipation can be acute, or it can be a long chronic standing issue that I've had for a long time. We would treat those actually quite differently. Oftentimes in acute medicine, one of the most successful things are prescription medicines. I get that. If I have strep throat, I'm not going to go exercise for an hour and expect my strep throat to go away. If I have appendicitis, I'm not going to eat a low-carb diet and expect my appendicitis to go away. It wouldn't work. I actually need medicine to overcome that. Or I need a surgery. These are hallmarks of the conventional American medical system: prescription medicine and surgery. If an organ doesn't work very well, we just cut it out. If we want to lose weight, we have a weight loss surgery. I'm very cautious about that, actually. Or we take a prescription medicine. But I want you to think outside of the box for a minute on chronic disease. If I have a chronic illness, like I'm perpetually depressed, I have a chronic migraine headache, I have dementia, or we're seeing this autism pandemic that's happening. 1 in 13 kids now is diagnosed with autism in certain states. Cognitive impairment, these are chronic issues, they're not acute issues. And these are most successfully treated with lifestyle interventions and perhaps even nutraceuticals. Now, does that mean that prescription medicines don't have any role? No, I think that prescription medicines can have a role in those. The problem is that oftentimes with chronic illnesses, we treat them the same as acute illnesses. We just jump on the medicine bandwagon. And the difficulty with that is oftentimes we see terrible side effects and we don't see improvement along the way. Several years ago, this doctor, his name is Dr. Harold Clausen, ran a clinic called the Country Clinic. And Harold Clausen passed away of a cancer that was diagnosed, and then he passed away within about 3 weeks. It was really tragic. Well, the ownership of that clinic, after he passed away, the governing body came to me and said, hey, Randy, would you work as a part of our team? I originally told them no, but eventually I said, yeah, I'll see a couple of patients. And I'll admit, I was interested in how a nutraceutical office function. These guys only do nutraceutical medicine. And I want to tell you the experience I had. They had an interview where I went and the entire office staff was in the interview. And they were just peppering me with questions. What's your style of practice? How do you function? They just were tons of questions. And to keep the story brief, one of them stood up and said, hey, Randy, are you going to prescribe prescription medicines if you work here? And I said, well, of course I'm going to prescribe prescription medicines. That's what I do. And one of the ladies there smashed her hands down on the table and she said, I quit. I will not work in an office where someone's prescribing pharmaceutical medicines. We are a natural office and we don't do that. And she stood up and stormed out of the office and was really angry. And I looked at everyone and I'm like, okay, that was a little melodramatic, but whatever. Look, how many in here take thyroid medicine? Anyone in here on thyroid medicine? And a couple of hands went up. And I'm like, oh, so you do believe in pharmaceutical medicine. Anyone in here on hormone replacement for terrible menopausal symptoms? And then a couple of hands went up. And I'm like, oh, so you aren't just a naturopathic office. You use pharmaceutical medicine too. What's my point? My point is that there's good science on both sides of the spectrum. And we become myopic if we say, I only do natural lifestyle medicine or I only do pharmaceutical medicine. I don't ever intertwine those two. And I think that's a disadvantage. When people ask me what type of medicine I practice, I'd smile with a big fat smile. I say, look, I'm a mutt. I'm not a purebred. I'm a mutt because I practice both sides of that medicine. I see the tremendous value in those. So I'm going to ask you to start out today. What's your approach? When you get sick, what do? Are you quick to jump on the pharmaceutical agents? Are you an exerciser that practices exercise medicine? Or are you kind of like this lifestyle junkie where you're like, well, look, did I get sick because I wasn't eating very good and I stopped exercise and I'm not sleeping good and I'm all stressed out and my relationships are in the toilet. I'm fighting with my wife or my husband. Look, those things matter long term for your health. And the problem is that in our society, we have to look at the big picture to make a big difference. I love this Facebook post by Dr. Perlmutter. He says, if there's one thing I wish everyone understood, it's that every time you eat a meal, you're sending a message to your brain, right? That makes a difference. That's a part of lifestyle medicines. If you get stuck in the pharmaceutical mode, look at how the pharmaceutical medicine industry works. We have a quality assurance program and technical services and medical acquisitions and purchasing and technology and research and development. And we're looking at side effects and education. These are important. I'm grateful we have those. They're very expensive to manage all that. And the reason it's expensive, the drugs become expensive because of that. And when you do a lot of pharmaceutical medicine, you really have to learn to read the fine print. So today I'm going to talk to you about the fine print in the pharmaceutical industry, and you're going to be like me. You're going to put your thinking cap on, and you're going to pay attention to some commercials. Let me tell you, I haven't sat down and watched a Netflix series in 10 years. I don't watch a lot of TV, but when I do watch TV, it's sporting events. And I love sporting events. And I'm fascinated with how many commercials are on television right now about pharmaceutical agents. The pharmaceutical industry is pandering to the public to say, look at these tools we have that make you healthy. And so you and I together today are going to do a little test. We're going to put our thinking caps on and we're going to critique these commercials. And I've got about 10 of them I want to show you. And I'm going to ask you, don't pay attention and get lost in the music and the dancing and the graphics and the comedy. I want you to read the fine print on the screen. Listen to the voiceover that comes through the music. Pay attention to potential side effects for some of these agents as we go through this process. This first medicine is for Jardiance. And this is fascinating because my kids can sing this tune verbatim. Here we go.
I have type 2 diabetes, but I manage it well.
It works 24/7 in your body to flush out some sugar. And for adults with type 2 diabetes and known heart disease, Jardiance can lower the risk of cardiovascular death too.
Serious side effects may include ketoacidosis that may be fatal, dehydration that can lead to sudden worsening of kidney function, and genital yeast or urinary tract infections. A rare life-threatening bacterial infection in the skin of the perineum could occur. Stop Jardiance and call your doctor right away if you have symptoms of this infection, ketoacidosis, or an allergic reaction. You may have increased risk for lower limb loss. Call your doctor right away if you have symptoms of infection in your legs or feet. Taking Jardiance with a sulfonylurea or insulin may cause low blood sugar.
Jardiance is really swell, a little pill with a big story to tell.
All right, so let's pick this apart. Jardiance is a diabetes medicine, and think of the tune. She says, it was easy to see that I'm lowering my A1C. Well, all of you go to the doctor and you have your A1C checked, and we're all excited about lowering our A1C. But do you need a pill to lower your A1C? Do you need Jardiance? One of my patients just called the other day and said, hey, my cardiologist put me on Jardiance. It cost me $500 per month. Do you have any samples for me? And I thought, well, interesting. If I pull up the prescribing information for doctors, look at this. Jardiance can cause diabetic ketoacidosis in patients with type 1 diabetes. It leads to dehydration. You have to be careful. Some people might get urosepsis or pyelonephritis. Those are awful kidney infections. They can lead to low blood sugar because it makes you pee off your blood sugar. That's how it lowers your A1C. When you're peeing off that blood sugar, you might get an infection down around your private areas, right? And you might get a yeast infection down there. It can increase the risk of an amputation, and some people can have hypersensitivity problems. Well, that's the fine print of that medicine, but when you watch that commercial, it looks like a super exciting drug that's going to make a huge difference in the lives of a diabetic. My friends, you can lower your A1C by what Dr. Perlmutter says. Every time you eat, you send a message to your brain and your liver and your kidneys, right? That's pretty important. Here's another one. It's called Farxiga, same class of medicine. Here we go.
I'm managing my high blood pressure, but I'm still a target for chronic kidney disease.
And my type 2 diabetes means I'm also a target. We are targets too.
Millions have chronic kidney disease, and 90% don't know they have it. So ask for your kidney numbers and Farxiga. If you have chronic kidney disease, Farxiga reduces the risk of kidney failure, which can lead to dialysis.
Farxiga can cause serious side effects, including dehydration, urinary tract or genital yeast infections in women and men, and low blood sugar. Ketoacidosis is a serious side effect that may lead to death. A rare, life-threatening bacterial infection in the skin of the perineum could occur. Stop taking Farxiga and call your doctor right away if you have symptoms of this bacterial infection, an allergic reaction, or ketoacidosis. And don't take it if you are on dialysis.
Take aim at chronic kidney disease. Ask your doctor for your kidney numbers and ask for Farxiga. If you can't afford your medication, AstraZeneca may be able to help.
Okay, if you can't afford it, let us know. We might be able to help you and give you a grant. Again, same class of medicine. We're trying to lower A1C. We're trying to lower blood pressure. We're trying to prevent cardiovascular disease, but there's some risks of ketoacidosis. Do you realize that when we first started talking to people about keto, it all scared them? When we talk about keto, our patients and their doctors would often say, well, I don't want to get into ketoacidosis. That's dangerous. Well, a ketogenic diet does not cause ketoacidosis. That's a totally separate problem associated with diabetes. Again, people can get dehydrated. They can get urinary tract infections. I'm not saying this is a crappy drug. I'm just saying I would not start here if all we wanted to do was lower our A1C and lower our cardiovascular risk. It's very expensive and there's some challenges. Is there a place for it? I think so, but it's not a starting point, right? And oftentimes patients will come in, see these commercials and say, hey, I want to lower my A1C and reduce my risk of cardiovascular disease. Let's start some Farxiga. And I'm always like, hey, well, let's slow down here. Let's pay attention to some other things. Look, here's a really common drug. Every person on this call knows someone who's taken Ozempic. Maybe they've taken Ozempic. I've actually used Ozempic in neurological problems like dementia. But I want you to watch this commercial. Pay attention to the message in this one. Look at the very beginning. Look at symptoms of allergic reaction. Pay attention to the fine print. Don't just watch the line dancing that they're doing at the bar. Pay attention to the voiceover and the fine print.
Type 2 diabetes? Discover the Ozempic Trizone.
Ozempic.
I got the power of 3. I lowered my A1C, CV risk, and lost some weight.
In studies, the majority of people reached an A1C under 7 and maintained it.
I'm under 7.
Ozempic lowers the risk of major cardiovascular events such as stroke, heart attack, or death in adults also with known heart disease.
I'm lowering my risk.
Adults lost up to 14 pounds.
I lost some weight.
Ozempic isn't for people with type 1 diabetes. Don't share needles or pens or reuse needles. Don't take Ozempic if you or your family ever had medullary thyroid cancer or have multiple endocrine neoplasia syndrome type 2 or if allergic to it. Stop Ozempic and get medical help right away if you get a lump or swelling in your neck, severe stomach pain, or an allergic reaction. Serious side effects may include pancreatitis. Gallbladder problems may occur. Tell your provider about vision problems or changes. Taking Ozempic with a sulfonylurea or insulin may increase low blood sugar risk. Side effects like nausea, vomiting, and diarrhea may lead to dehydration, which may worsen kidney problems. Living with type 2 diabetes?
Ask about the power of 3 with Ozempic.
All right. Now, look, I don't hate Ozempic.
Type 2
I've
diabetes.
taken that medicine before. I wanted to know what it feels like to receive an injection of Ozempic. What happens with nausea And is there vomiting? Did I get diarrhea? Here's the package insert that the FDA requires. You should be very careful if you have any history of medullary thyroid cancer or a thyroid problem. And pay attention, it can cause pancreatitis, diabetic retinopathy, low blood sugar called hypoglycemia, kidney injury, hypersensitivity reactions. And in the early stages, we didn't know what it would do with your cardiovascular health. I'm not saying you shouldn't be on Ozempic. I've actually used Ozempic for people who had difficulty getting their A1C down after they had made significant dietary changes and were a little bit more physically active, and to see if we could improve their neurological functioning. But right here, you got to pay attention. Look at this advertising. This is interesting. It says the most common adverse reaction happening in more than 5% of the patients: nausea, vomiting, diarrhea, abdominal pain, and constipation. So this would not be a medicine I'd put someone on if they struggled with GI side effects. They have to be really thoughtful and careful about that. So another interesting thing about that commercial is the lady says, I got my A1C down below 7.0%. 7%. I've shared this study many times in my lecture series. It's from the neurology, and it's looking at what causes brain atrophy. The number one predictor of brain atrophy is age, right? So an 80-year-old has more risk than a 50-year-old. But the number two predictor, according to this study, was an increased blood sugar. And it's interesting that of an increased blood sugar, look at these amounts. An A1C of 5.3 to 5.8 actually showed a linear relationship that the brain would shrink even with an A1C of like 5.7, 5.6. So that Ozempic commercial is fascinating when the lady says, I got my blood sugar below 7.0. Man, our goal is to get blood sugar much lower than that. And you often cannot do it on medicine alone. You have to be really, really thoughtful about your diet. So while I'm not overly critical of Ozempic, Ozempic by itself is insufficient at lowering the risk of shrinking the brain, right? We've got to get that blood sugar down. Let me show another commercial. This is a mental health commercial, and I've got a couple of these. I want to talk to you about mental health and mental health medicines for a second. Check out this commercial.
Depression. It made me feel like I was trapped in a fog.
This is art inspired by real stories of people living with bipolar depression.
I just couldn't find my way out of it.
The lows of bipolar depression can take you to a dark place and be hard to manage. Latuda could make a real difference in your symptoms. Latuda was proven to significantly reduce bipolar depression symptoms, and in clinical studies had no substantial impact on weight.
This is where I want to be.
Latuda is not for everyone. Call your doctor about unusual mood changes, behaviors, or suicidal thoughts. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients on Latuda have an increased risk of death or stroke. Call your doctor about fever, stiff muscles, and confusion, as these may be life-threatening, or uncontrollable muscle movements, as these may be permanent. These are not all the serious side effects.
Now, I'm back where I belong.
Ask your doctor about Latuda and pay as little as $0 for your first prescription.
Did you catch the fine print in that said seniors with dementia have an increased risk of death from this medicine? And it says young people on Latuda have an increased risk of suicide. So it's fascinating that we take someone with terrible depression, a bipolar depression, and one of the risks of the medicine may be to actually increase the risk of suicidal thinking. I'm always really careful with these medicines. This is the package insert the FDA requires with this class of medicine. Look at this. On Latuda, warning, there's an increased mortality, that means death, in elderly patients with dementia-related psychosis, suicidal thoughts, or behaviors. This should never be used in our seniors, ever. It's a huge risk. And if you look at the warnings over here, the precautions, stroke, neuroleptic malignant syndrome, tardive dyskinesia, Metabolic changes, it actually raises your blood sugar, increases your risk of diabetes. So we just talked about trying to get our blood sugars down, but we take a depression medicine and our blood sugars actually go up. Leukopenia, neutropenia, this means it affects our immune system. It's not as effective anymore. We're at much greater risk of an infection. And it lowers blood pressure, hypertension, and syncope. So I'm really cautious about these. For about 7 years, I owned a mental health office. And when people came into me, they either hated me or they loved me. Because when they came in, the very first visit, I seldom prescribed medicine. I just talked to them about lifestyle because of the impact of lifestyle on mental health and neurological health. Let me show you another mental health medicine.
It follows you wherever you go.
Pay
It's
attention to the
if you've been on an antidepressant for at least 6 weeks. You're frustrated that your depressive symptoms are still with you. Seroquel XR, when added to an antidepressant, is approved for the treatment of major depressive disorder. For many, taking Seroquel XR with an antidepressant was proven more effective for treating unresolved symptoms of depression than an antidepressant alone. Call your doctor if you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death. Your doctor should check for cataracts. Other risks include decreases in white blood cells, which can be fatal, seizures, increased cholesterol, weight gain, dizziness on standing, drowsiness, impaired judgment, and trouble swallowing. Use caution before driving or operating machinery. For more help putting distance between you and your depression, ask your doctor about adding Seroquel XR today. Learn more at seroquelxr.com. If you can't afford your medication, AstraZeneca may be able to help.
So isn't it interesting that medicine, they're advertising it to use together with another medicine. So if you got depression, but your symptoms aren't very well controlled, well, let's add a second agent. Oh, by the way, there's a lot of risks with this medicine. Just this week, I held meetings with directors of assisted living centers who wanted me to review some of the cases of their clients. Both cases that I reviewed, individuals were taking Seroquel in both cases. In one of them, their doctor was kind enough to join a telemedicine call with me. And I said, this is not good medicine. Why are we using this? Well, they're not sleeping. And I'm like, oh my gosh, there's a lot of things we can do for sleep. We're using an antipsychotic medicine to induce sleep in a dementia patient. And right here, the warning says this has an increased risk of death and all of these challenges associated with it in our seniors. But this is the state of affairs. We've lost the ability to recognize lifestyle and nutraceutical medicine as a legitimate alternative to pharmaceuticals, especially in our seniors. And it really ticks me off, right? Carol knows this. I gave the poop award to one of these medicines because the doctors were saying this is what we should use in dementia. And I'm like, no, we shouldn't because of increased risk of stroke, neuroleptic malignant syndrome, fever, chills, mood disorders, high blood pressure, high cholesterol, weight gain, tardive dyskinesia. I'm going to show you some videos of what tardive dyskinesia is. Lessening your immune system, cataracts, and anticholinergic activities. Completely blocks the function of choline in our seniors. It's just not a good decision to use, and yet it's used all the time in conventional medicine. Let's go on. Here's another one. This is called Vraylar.
Unresolved depression symptoms were in my way. I needed more from my antidepressant. Vraylar helped give it a lift.
Adding Vraylar to an antidepressant is clinically proven to help relieve overall depression symptoms better than an antidepressant alone. And in Vraylar clinical studies, most saw no substantial impact on weight. Elderly dementia patients have increased risk of death or stroke, report unusual changes in behavior or suicidal thoughts. Antidepressants can increase these in children and young adults, report fever, stiff muscles, or confusion, as these may be life-threatening, or uncontrolled muscle movements, which may be permanent. High blood sugar, which can lead to coma or death, weight gain, and high cholesterol may occur. Movement dysfunction and restlessness are common side effects. Stomach and sleep issues, dizziness, increased appetite, and fatigue are also common. Side effects may not appear for several weeks.
I didn't have to change my treatment. I just gave it a lift.
Ask about Vraylar and learn how AbbVie can help you save.
Isn't it fascinating? That commercial says that you can have all these terrible side effects, and in reality, they may not even show up for several weeks or months. So you take this medicine long term, and all of a sudden, 3 or 4 months down the road, you got these terrible symptoms. That is so unexpected, because most people expect to take a medicine and have a side effect today. But with that medicine, that side effect's going to come 4 months down the road, and you're not even going to have any recognition of why you're feeling like you're feeling, because you've been taking it for 4 months. I don't want to keep beating this up, but this is the same class of medicine. One of the most common side effects from mental health medicines is weight gain. My patients say, I started this medicine and I gained 20 pounds. My blood sugar is going up. I'm now diabetic. We have to pay attention and be aware of these things. Again, this medicine is totally contraindicated in seniors. It should never be used. And when I see it being used, I lose my mind. I get after people about it. Okay, let's do another one.
Bipolar 1, I got help to push back.
I got help to push back.
We got help to push back with Lybalvi.
Once daily prescription Lybalvi is proven to treat manic or mixed episodes of bipolar 1 in adults to help you push back. Elderly patients with dementia have an increased risk of death or stroke. Do not take Lybalvi if you are taking opioids or are in opioid withdrawal. The samidorphan in Lybalvi can cause severe opioid withdrawal that can lead to hospitalization or increased risk of life-threatening overdose. Get emergency help if you have trouble breathing, become very drowsy with slowed or shallow breathing, or feel faint, very dizzy, or confused, or if you have fever, stiff muscles, confusion, rash, swollen glands, or problems with your liver, kidneys, heart, or lungs. Other serious side effects may include high cholesterol, weight gain, potentially fatal high blood sugar, uncontrolled body movements, which may be permanent, dizziness upon standing or falls.
Are you ready to push back against bipolar 1? Ask your doctor if Lybalvi is right for you.
Bipolar disease is awful. I shared this commercial because I had a patient in the last month who came to my office with dementia, and he's on this medicine. So I called his psychiatrist and I said, hey, I'm reaching out to you because this patient has dementia and he's on this medicine and his blood sugars are elevated. And she says, well, his blood sugars are elevated because he was on a different antipsychotic and we changed to this one. And I said, oh my goodness, this has this medicine right here called olanzapine in it. Olanzapine is known by another name called Zyprexa, which raises blood sugar. And I said to them, I don't think I'm the right guy for you because I can't help his cognitive function if he's on this medicine. Well, it's interestingly enough, he's drinking about 2 liters of Mountain Dew every day. And he came out because he said, listen, my blood sugar is high because I'm drinking Mountain Dew like crazy. And I said, well, that's part of it, but the medicine too. We just got into this big discussion and I thought, oh, I really wanted to focus on lifestyle medicines and he just wasn't at the point that he could do that. It was fascinating. Look at all of these risks associated with this one particular medicine. Now, they said that in the commercial, this can cause movement disorders. I want to show you what they mean by a movement disorder. I'm going to show you this video in just a second, but this book right here, Brain Energy, was written by a psychiatrist at Harvard. And this psychiatrist says that mental health disorders are a metabolic disorder in the brain. Mental health disorders are a blood sugar and insulin resistant problem in the brain. So if we try to treat those disorders with medicines that raise your blood sugar or promote insulin resistance, we're not gaining any ground. We're actually going backwards. And this is a current battle going on in medicine all across the world because bipolar and schizophrenia and depression, I don't make light of any of these illnesses. They are horrible, horrible illnesses. But we can't ever expect to get on top of them if we don't change the food chain and we don't change the way we treat them, if we perpetuate insulin resistance problems. And I have long talked, these are slides that I used in lectures that I've done now for several years, that mental health disorders are related to blood sugar issues. So in this, you'll see someone was using a continuous glucose monitor. This is actually a picture of one of my patients. She had terrible anxiety and panic attacks every time her blood sugar would bottom out. It was fascinating. Well, mental health disorders go up when your blood sugar is perpetually elevated. This is hyperglycemia. Insulin resistance leads to depression. And hypoglycemia happens in individuals that aren't just diabetic. It happens in you and I. It happens when we're in a fasted state. So we have to pay attention to those. That's why our roadmap encourages people to use a continuous glucose monitor. And we pay attention to when our blood sugars drop to low levels or when they rise to high levels, okay? So mental health disorders are metabolic problems. Now, if we get tricked into thinking, well, I took this pharmaceutical agent because I had depression, anxiety, and bipolar, and I get a movement disorder, I can take another medicine. Because that's what we do. We treat side effects of one with another medicine. This medicine called Ingrezza that I'm going to show you treats movement disorders. I want you to pay attention to his fingers and his mouth as I go through this.
My mental health was much better, but I struggled with uncontrollable movements called TD, tardive dyskinesia. TD can be caused by some mental health meds.
And it's unlikely to improve without treatment. I felt like my movements were in the spotlight.
Ingrezza is a prescription medicine to treat adults with TD movements. Ingrezza is different. It's the simple, once-daily treatment proven to reduce TD that's #1 prescribed. People taking Ingrezza can stay on their current dose of most mental health meds. Ingrezza 80 milligram is proven to reduce TD movements in 7 out of 10 people. Don't take Ingrezza if you're allergic to any of its ingredients. Ingrezza may cause serious side effects, including sleepiness. Don't drive, operate heavy machinery, or do other dangerous activities until you know how Ingrezza affects you. Other serious side effects include potential heart rhythm problems and abnormal movements.
It's nice. People focus more on me.
Ask your doctor about #1 prescribed once daily Ingrezza. Learn how you could pay as little as $0 at Ingrezza.com.
Okay, I want to show you some movement disorders. Let me go ahead and show you some videos. If you don't know what you're looking for, it's hard to see. But I want you to watch these muscle movements of the mouth. Okay? That is a side effect of mental health medicine. I'm going to play that again. This beautiful lady goes to her doctor and she can't control the movement in her mouth. That's called tardive dyskinesia. And that is caused by some of these mental health medicines that we're talking about. So I just showed you Lybalvi and Vraylar and Seroquel. They all have an increased risk of these movement disorders that don't go away when you get them. This is horrible, right? Here's another one. Let me show you another video. This is common if you go into a nursing home and you see many seniors in a nursing home with dementia and they're on mental health medicine. This is what they do.
That's wonderful. Can you tell me how long you've noticed the tremor of the face and jaw and tongue?
See, you think he's just kind of sticking his tongue out. He's kind of messing with this.
Can you tell me how long you've noticed the tremor of the face and jaw and tongue?
That is called tardive dyskinesia. Let me show you another form of tardive dyskinesia. This comes from The Lancet, which is a medical journal. This is a patient who's been on high-dose antipsychotic medicines for a long time, and he's developed a Parkinsonism. Now, I say Parkinsonism because it's not Parkinson's disease. It's similar to the symptoms of Parkinson's disease, but it's induced by mental health medicines. So you can see his hand tremoring. You can see his movement. His face is very flat. He doesn't have much facial expression. When he walks, he doesn't swing his arms. That's common in Parkinson's as well. A very stoic presentation, right? Very slow, very delayed. Let me show you another one. This doctor's going to talk about this with a patient. Oh, it looks like I may have done the same one. Sorry. So again, Ingrezza is the medicine that treats that. This is a little bit different commercial.
My mental health was better, but uncontrollable movements called
fingers.
TD, tardive dyskinesia, started disrupting my day.
TD felt embarrassing.
Watch your lips.
I felt like disconnecting. I asked my doctor about treating my TD and learned about Ingrezza.
Ingrezza is clinically proven for reducing TD. Most people saw results in just 2 weeks. People taking Ingrezza can stay on most mental health meds. Only #1 prescribed Ingrezza has simple dosing for TD. Always 1 pill once daily. Ingrezza can cause depression, suicidal thoughts, or actions in patients with Huntington's disease. Pay close attention to and call your doctor if you become depressed, have sudden changes in mood, behaviors, feelings, or have thoughts of suicide. Don't take Ingrezza if you're allergic to its ingredients. Ingrezza may cause serious side effects including angioedema, potential heart rhythm problems, and abnormal movements. Report fevers, stiff muscles, or problems thinking, as these may be life-threatening. Sleepiness is the most common side effect.
Take control by asking your doctor about Ingrezza.
So they're putting some responsibility on the patient, and they're saying, you take control by asking your doctor for this medicine. And my point is, hey, you take control by changing your diet, change your lifestyle. Let's consider what pieces we might be missing that helps improve your mental health, because once we get those symptoms, man, they are so difficult to get rid of. I'm going to skip the next one here because I'm running out of time and I want to be able to share a couple of other videos. This is one about
Think you know all there is to know about getting your cholesterol right? You may be wrong, because getting bad cholesterol down might be just part of the equation. You may also want to get your good cholesterol up. Even more surprising, this cholesterol medicine does both. Crestor. Crestor, along with diet, can lower bad cholesterol by up to 52%. But Crestor also raises your good cholesterol. Down with the bad, up with the good. Is Crestor right for you? That's between you and your doctor. Crestor is not for everyone, including people with liver disease and women who are nursing, pregnant, or may become pregnant. Simple blood tests are needed to check for liver problems. Tell your doctor about other medications you're taking, or if you experience muscle pain or weakness, as they may be a sign of serious side effects. Down with the bad, up with the good. Talk to your doctor about Crestor.
If you're without prescription coverage and can't afford your medication, AstraZeneca may be.
Okay, down with the bad, up with the good. I want to show you another video. This one has a commercial because it's a news outlet.
Adventures, you need WeatherTech.
Okay, here we go.
We're back now with news about the blockbuster cholesterol drugs called statins. Doctors say they work wonders to prevent heart disease, but many patients say the side effects are just too painful. Now, for the first time, doctors say there's proof that those patients are right. And as NBC's Rahema Ellis reports, they're pointing to new alternatives.
Some of the most popular drugs in the country are statins, taken by about 25 million Americans to lower cholesterol and reduce heart disease. But they can also cause debilitating side effects, muscle pain, weakness, and cramping, reported by 5 to 20% of patients. Diane Solhan was one of them.
Everything was sore, and every time I moved, I get this more of a bad achy feeling.
For years, some doctors thought these complaints might be psychosomatic, all in their heads. But a new study concludes that the pain is real.
This now confirms for the first time that muscle intolerance to statins is a real problem affecting a significant portion of patients, and that those patients now we need to be able to develop alternatives to treat them.
The good news is there is potential relief.
The drug has been approved.
Already, 2 cholesterol-lowering drugs have been approved by the FDA. One, Repatha, cuts levels of bad cholesterol by more than half, according to the new study. Diane says the medication changed her life.
It does the same thing, but it doesn't have the side effects that the statins have.
But the bad news is they're expensive, about $14,000 a year, and only FDA approved for people with hereditary high cholesterol. The question now is whether the FDA will approve them for a wider group of patients to cut their cholesterol and their pain. Rahima Ellis, NBC News.
Hey, NBC News fans.
Okay, isn't that interesting that the doctor they're interviewing said for years our patients would complain about leg pain and we thought it was just in their head. It's psychosomatic. You're making it up. You don't really have pain. Oh, just kidding. Now we're realizing it's real. It's legitimate pain. So we came up with a new drug and it only costs $14,000 per year. So I don't know about you. Can you afford $1,200 per month for a new cholesterol-lowering medicine? How about just change diet, exercise, right? Take some nutraceuticals that have tremendous benefits. I'm going to skip this as well, and I'm just going to go to the end because I want to make sure that I share with you two more things. When you hear a drug has significant benefits, you have to keep in mind the term significant does not mean what you think it means. Significant doesn't mean that, oh my gosh, this drug was life-changing, changed everything. Significant has two meanings in the drug world. First of all, is it statistically significant? And what that means is that the drug did something different than the placebo that people were taking. That it's unlikely that was just coincidence. That's what significant means. Statistically significance means that it actually performed different than placebo. The second thing is, did it have clinical significance? Clinical significance implies, how did the patient feel when they took that medicine? Did it actually relieve a symptom? Did they function a little bit better? Did it delay the progression of a disease or increase their survival rate? That's what significant means. And so I'm always looking at this from a quality of life standpoint. If my patients come to me and says, hey, I heard about this new drug for dementia that was approved, it has significant benefit. What I always think about is, okay, did it perform a little bit better than the placebo that they were testing? Okay, yes, it did. And overall, how does it change the quality of life of the individual? That matters. Does it change the quality of life for $1,200 a month or $100,000 or for $30 a month, right? We have to be thoughtful. That's what significant means in the drug world. And I close with this thought, my friends. I am not a drug hater. When I talk about the risks and challenges of these medicines, I'm doing it to inform people, but I don't hate these drugs. I prescribe them. I prescribed semaglutide 3 times yesterday. I don't hate the drugs, right? I love the science and I love to practice medicine. I love to learn and to share, and I'm not afraid to say, hey, that's a crappy drug for you. I would not even go down that pathway. I think that's a bad decision. I want to use all of the available tools that help improve the health of our clients. That includes lifestyle, that includes nutraceuticals, and in many cases, that includes pharmaceuticals, right? But I always start with lifestyle medicines. Always. That has to be the starting point. I love the use of nutraceuticals. I love herbs and vitamins and minerals and therapies. When I say therapies, I'm talking about things like red light therapy, beamer therapy, pulsed electromagnetic therapy. I love hyperbaric medicine. I love exercise with oxygen. I love sauna therapy. The science that underpins those therapies is phenomenal, and I'll always recommend them. The difficulty is they're not covered by insurance, so people have to be willing to spend a little bit to do those types of interventions. And then I will always incorporate medicines when symptoms don't get better from all of the above, but I don't start with that. If someone comes in with dementia, my starting point isn't dementia medicines. They don't work. But we start in other areas, and then I'm not afraid to add donepezil to individuals who want them. I'm okay with that, right? So, natural versus pharmaceutical. We always clean up our lifestyle. We do comprehensive labs. We try to identify all the medical challenges. We apply nootropics or nutraceuticals where they're appropriate. We apply brain therapy interventions. And then when we still have symptoms that suck and we just can't overcome them, then we prescribe a prescription medicine to help us out along the way. That's kind of my general approach. Sometimes I start with medicine. It depends. If you're menopausal, I'll always start with hormones. The research about them is so good. The problem is this is the starting point in conventional medicine. We start with a prescription and we work our way backwards, right? To me, it's just kind of a backwards way of doing things. The enhanced protocol really looks at cognitive symptoms, traumatic brain injuries, and mental health as very similar to each other. It's just a different part of the brain that's affected. And if we can work through the lifestyle things that we're talking about, people get better and they do better. So the roadmap looks at the academic research, the current standard of care, and then applies all these principles of functional and naturopathic and prescription and lifestyle and supplement. We do all of those because that's where we think we get the very best outcome. So with that in mind, I haven't left very much time and I even skipped a couple videos, but I want to offer some discussion today.